So actually, there are two sections to this presentation. The first is just trying to understand what kinds of different research questions could be there and what are the different types of epidemiological study designs which would be mostly appropriate for these questions. And then we are going to take up one example and see what different scenarios could crop up wherein the research question changes and alongside the change in the research question, the study design also alters. So the first, I think half an hour, we'll just try and understand the research questions and the appropriate study designs. So assuming that all of us know the basics of the study design, we will move ahead. So the first, these are common questions which we come across in our dissertation or different small projects which we do. So the common themes which are addressed through these questions is what I have taken up. So first could be as simple as finding out the disease burden and the factors associated with those prevalent cases. So if your question is about trying to understand what the disease burden is and what are the factors which are associated with the cases you have identified, then you will go in for a cross-section study. The characteristic feature of which is that there is a single interaction between the investigator and the respondent. It is the easiest study to do, and majority of the studies conducted for the thesis or for the small projects are cross-sectional studies. So the epidemiological measure which we estimate by using such studies are the prevalence rates or the odds and the odds ratios. An example of this kind of study would be cross-sectional study of prevalence of blindness and the socio-demographic factors associated with it. So a one-time interaction, the investigator will conduct a survey and identify people with without blindness, which will help them to estimate the prevalence of blindness, and along with it, data on socio-demographic factors or characteristics will be collected, which will be analyzed. Another research question which could come up is what is the risk of a disease in a particular population? Or more commonly, what we do is try and identify the risk factors for a disease or even for outcomes, right? So various kinds of outcomes. So when we talk of risk, the ideal study design would be to conduct a cohort study because you need to calculate the incidence in those studies, and you need to identify the new cases which have occurred in a baseline population which is free of the disease. So you would need to identify a cohort and follow the cohort to identify people who have transited from the non-disease to the disease state. You can also conduct a case control study. Now, to identify risk factors, you can also conduct a case control study wherein you will calculate the relative risk. If the outcome you are studying is a rare disease, the odds ratio will be equivalent to the relative risk. And if the disease is common, the only limitation is you cannot equate the odds ratio with the relative risk. You will have to report and interpret your estimate as odds ratio, which are a bit difficult to understand compared to the relative risk. That is the only issue here. So when you want to find out risk factors, you invariably have to make comparisons. And one of the ways to make the comparisons is to report differences. Another is to report ratios. So the commonest thing which is noted is reporting the ratios, either odds ratios or the risk ratios. An example of this kind of study will be cohort study to assess anemia as a risk factor for low birth weight children, babies. The third scenario which I'm taking up is where you want to find out effect of various interventions. That is, usually we say we want to measure the effectiveness of the interventions to reduce the risk of disease. Now, such kind of research questions invariably will require intervention studies. So it could be randomized. The ideal, of course, gold standard is the randomized controlled trials. So again, you will calculate the incidence rates and the relative risk or the risk ratios for such kind of studies. An example of this kind of study would be an intervention study to assess the effectiveness of iron supplementation to prevent low birth weight. The third category of the questions which are not taken up so commonly is where we want to measure the effectiveness of interventions, but this is to see whether the interventions reduce the length of the illness. There is some mistake I have made there in editing, but to reduce the period of illness or to lengthen the survival period. That is what you would want to do when you want to study time to event, means time to death or time to recovery. That is what you are interested in. Now, when you want to do time to event is your outcome of interest, you will invariably do a cohort study or a intervention study. You will calculate hazard ratios in these kinds of studies. So an example of this study would be study the effectiveness of a new drug in improving survival of patients with breast cancer. So the duration of survival, the 5-year survival, of the period of survival, whether it is less or more without intervention, this is what we would be interested in this kind of study. The next one is usually which is done in the departments which are involved in diagnostic workup, say the biochemistry or the microbiology, pathology departments, where they are interested in assessing the validity and the predictive values of a new test or a tool. So again, this would require a cross-sectional study wherein both the new test as well as the gold standard test is offered to the participants, and you then assess the validity and the predictive value of the test against the gold standard. An example of this kind of a study would be a cross-sectional study to assess validity of a new screening tool for breast cancer. So these are, I thought, some of the common scenarios. And then one of the critical points which decides your study design is your research question. So we need to understand what our research question is, have a clarity about our research question, and then based on the feasibility aspects, we will have to choose an appropriate study design. Do you have any questions till now? Because we will now see some examples and we would discuss what would be the appropriate study design for some of these research questions. Do you have any questions till now? Because I have gone a bit fast, I know. But if you want us to go back and see a particular outcome and what kind of study design, we can do that. Anyone has any questions? Ajit? Yes, please. Yes.
Ma'am, suppose if I am doing interventional study without a control, so which study design it is?
So most probably you are doing a before-after study, right? You are thinking of doing an intervention. You are trying to measure the outcome of interest before the intervention. You give the intervention, and in the same person's post-intervention,
Yes,
that is a before-after, also known as a quasi-experimental study, a before-after study.
yes,
Right?
ma'am.
But
Yes,
this
ma'am.
study, remember, has a limitation, a very big limitation, because the circumstances in which you gave the pre-test, right? And the circumstances in which the post-test was conducted, you have no control on those circumstances or factors. So there is no guarantee that those factors remain the same. So usually it is the randomized control, which blinding with allocation concealment, which is practiced, a parallel design is a gold standard. But there are circumstances where you cannot implement the gold standard trial design. There people do the pre and the post test, but ideally it should be avoided. Are you getting me?
Yes, ma'am. Thank you, ma'am.
Welcome. So we'll just go and discuss a few questions so we understand whether we have really understood the the preliminary part, which the introductory session. So we have to just tell what will be the study design, the measure of frequency, and the measure of effect in these the questions which I have put forth in this slide. And the second part we will neglect for now. So the first question is, so I would really want volunteers to think and to tell me, at least to begin with, what study design would be appropriate for these questions, right? So is wealth index associated with childhood malnutrition? That is family wealth index of the family associated or household associated with childhood malnutrition. So what would be an appropriate study design for this research question? Anyone would like to answer? Yes.
Yes, ma'am.
Yes.
It might be a cross-sectional study.
Yes, you are right. This will be a cross-sectional study, right? Now, why do you think a cross-sectional study is appropriate?
Because we need to know about the childhood malnutrition, and then the
Okay.
associated factor is the wealth index. So childhood malnutrition, there is a one-time approach will be there. So we will collect that one time only, and then we try to see the associated factor, that is wealth index, whether it is associated with that or not.
Yes, so you are right. So what we are interested is understanding the association between the wealth index and the childhood malnutrition, and a cross-sectional study would be sufficient for us to do this. Just a minute, I'm just trying to get a pen and I'm in a bit of a problem. What is the issue? No, this is not. Let it be. So you are absolutely right. I think it was Dr. Dhaval, right? So Dr. Dhaval has
Yes,
given
ma'am.
the right answer that we would be interested in conducting a cross-sectional study. Now, what would be the measure of frequency and measure of effect in this study? So I'll just help you out because I don't know, if you want to try, you can try. For the outcome in childhood malnutrition in a cross-sectional study, what would you measure?
It is the amount of the childhood malnutrition. That is the prevalence of malnutrition.
Yes, you are absolutely right. So you will actually measure the prevalence of malnutrition, right? And then
Yes.
you can measure the prevalence rate, the prevalence ratio, as well as the odds ratio in this cross-sectional study to study the association between your exposure and the outcome. Very good. The next research question is, does low birth weight increase the risk of metabolic syndrome in adulthood? So anybody else would like to take up this? What would be the appropriate study design
Cohort,
for
ma'am.
this research
Cohort
question?
study, ma'am.
Yes, cohort. Who said that?
Cohort study, ma'am.
Yes, Priyanshu. Can you elaborate?
Ma'am, because we want to find the risk of metabolic syndrome.
Hmm.
We want to measure the risk of metabolic syndrome in childhood.
Okay. So how would you go about doing the study?
Ma'am, cohorts, I'm not getting your question, ma'am.
So you said cohort study. What is your exposure of interest?
Exposure is, ma'am, low birth weight.
Right. What is the outcome?
Outcome metabolic syndrome.
Correct. So you want to do a cohort study means it is a follow-up study, right?
Yes, ma'am.
So how would you do the follow-up? From where to where? From which point to which point?
Ma'am, from exposure to outcome
So from low birth weight to, oh, I'm sorry,
to metabolic syndrome.
just a minute. I am doing something out here and Just bear with me for 1 minute. Yeah. So what you said was right. But what is the issue with the study design you have mentioned? Right?
Ma'am, loss
Okay,
to follow up.
from birth to the development of metabolic syndrome. What is the common age group in which metabolic syndrome occurs? It will occur either in adulthood or in later in age, right? So it will be a very long period of follow-up. Agree?
Yes, ma'am.
So it would be difficult, if not impossible, to do the study. From the birth to the occurrence of metabolic syndrome, it will be a very long period of follow-up. So what is, if not the cohort study, because now you're looking at the association again of two variables, you have to do a comparison. So there are limited options you have, isn't it? A cross-sectional, a case control, a cohort, or an intervention. So which study design would be appropriate for this research question?
Ma'am, we can also do comparative cross-sectional study. Can we do?
Cross-sections, no. A cross-sectional study would mean that you will have to collect data on all the individuals and then categorize people according to presence absence metabolic syndrome, which is possibly not necessary. What you would ideally do is a case control study. So you would identify individuals with metabolic syndrome in the present time. You will identify individuals without metabolic syndrome, and assuming that there is good record keeping and all these people have records of their birth weight, you will get information or data on their birth weight. That is the exposure, and you will calculate an odds ratio. You will not be able to calculate the prevalence rate or the incidence rate here. You will be able to calculate the odds and the odds ratio. Are you getting me, Dr. Priyanshu?
Yes, ma'am.
So it is not just the research question, but the feasibility is another angle which you should remember, and then think for other alternatives to find the appropriate study design. The third research question is, do obese pregnant women have a higher risk of cesarean section deliveries? Anyone would like to take up this question? So Dr. Sampath is saying cohort study. Can you explain a bit further, Dr. Sampath?
Hello, ma'am.
Yes, Sampath.
Hello.
Yes, Sampath. Why are you saying that you will choose a cohort study? It's a correct answer.
Ma'am, here in this study also, our exposure is obese pregnant woman, and outcome is risk of cesarean section deliveries. So that's why it's a follow-up study. So a best suitable epidemiology study is a cohort study, ma'am, in this case.
Yes. So compared to the previous study, the follow-up period maximum is going to be how much? 9 months, right? So this study is doable as a cohort study. You identify women, pregnant women who are obese or non-obese in their first trimester itself or at baseline, and then you do a follow-up, and the follow-up period is doable, is feasible. So you can do a cohort study very easily for this research question. So again, you are looking at your question, you're looking at feasibility, and you can decide on your study design. Now, the third question is, do patients of complicated COVID-19 receiving a novel treatment have better treatment outcomes? So what would be the study design for this particular research, ideal design?
The interventional study.
Yes. So intervention study, somebody mentioned randomized control trial, very much true, because we are looking at the intervention, a novel treatment among COVID-19 patients. So we would like to randomize these patients into two groups, one receiving the standard treatment, one receiving the novel treatment, and of course then follow them up for outcomes, for favorable and unfavorable outcome. So for this question, an intervention study is a must. The next question is, does the new chemotherapeutic regimen improve survival rates of patients with breast cancer? Which study
RCT, ma'am.
Yes. RCT, correct. But what will be your the next question? What will be your measure of frequency and measure of effect? Now you have to contrast this with the previous question. In the previous question, my outcome was probably, say, unfavorable and favorable outcome. And in unfavorable, I'm talking in terms of mortality. So what is the mortality rate in those who were given the standard treatment, in those who were given the novel treatment? Or the severity of the disease, or the complications, presence or absence of complications. What would be my outcome of interest in the last research question? So this is an example of time to event, right? Because I'm talking about survival. So what I'm interested here is whether the period of survival increases in the new chemotherapeutic regimen compared to the standard treatment, whether the people are surviving longer. So here, my study design, very rightly said, is an intervention study, but my outcome is time to event. So I will calculate hazard ratios as a measure of effect. While in the previous example, most probably I will calculate relative risk or risk ratios, relative incidence rate in both the groups, and compare them as a ratio, that is a relative risk. Here, I will calculate the hazards and the hazard ratio. Now, I will give you another question. If there is a new point of care test for diagnosis of, say, malaria, which is where the results are given quickly, and it is a non-invasive test, how would you design your study? Which design would you use to calculate the validity, that is the sensitivity and specificity of the test? For some of you all who have joined late, some of those who joined early can answer.
Cross-sectional study, ma'am.
Cross-sectional.
You have mentioned in the
Yes, correct.
Yeah.
So you would do a cross-sectional study in which you would use the gold standard as well as the new test in all of these participants, and then by 2x2 cross table, you would calculate your sensitivity, specificity, and your predictive values.
yes,
So we have an idea about what kind of study designs we could think of for different kinds of research questions. And you always have to consider the feasibility aspect, which is equally important. So this actually ends our first part, the introductory part for understanding how research questions are helping us decide our study design.